Hi. The following video is an education program about multiple sclerosis that I did almost 20 years ago in conjunction with the National Multiple Sclerosis Society. It was given to a hospital staff in order to give them a better understanding about what MS was all about. I deleted the segment about the National MS Society and just included the portion that I did myself. The video was taken by the hospital staff and was given to me personally. I think that you will find many parts of this program to be very useful.
The afternoon session. We have a couple more people coming in. I would like to introduce our next speaker, who is Ann Majerus, and she's the Program Director and Services Director for the Multiple Sclerosis Society. Also, we have with us Debbie Petrina, and she is a person who actually has multiple sclerosis. And the two of them came here to tell us a lot, hopefully, about what we need to know about acute exacerbation of MS. They have a film, and hopefully we'll have a real pleasant afternoon, and we'll learn a lot about that disease and its process. Please welcome Debbie and Ann.
Supposed to pass on the microphone.
Hook me up.
Hook you up here.
Thanks.
And I'll put this in your...
That's good. Yeah. Reel over here. That's great. Thanks. He said he could probably just drop it in the basket.
You need your papers?
Yeah. I don't think so.
Okay.
Okay, thanks. Hi. My name is Debbie. I'm really pleased to be here today. I can't tell you, it gives me always great pleasure in talking to people about MS because I really feel it is such an important thing to make people aware of what MS is all about and just take some of the frightening aspects away from it. I myself personally have had MS over 13 years. I was only 25 years old when all of my symptoms first came out for me. And I do have a family. I have a 10-year-old son, and I do manage my life very effectively with it. One of the most difficult things about MS is that it is a very unpredictable illness, and it is, a lot of times, it seems to be so uncontrolling, which makes it such a devil. Nevertheless, I have found over the years that effectively, it is very manageable. There are a lot of things that can be done. I've been a peer counselor with the MS Society over 8 years, and I've talked to lots of people, and I always tell them it's a good news, bad news type of illness. Unfortunately, we always see the worst case scenario, the person in the wheelchair, the very debilitated type of individual. That's the worst case, that's the bad news. However, and the bad news is it's a chronic, as they say, disease. I hate that word, but it's a disease that will never go away. There's no cure. However, there are a lot of symptoms that could be treated, both medicinally and in non-medicinal ways that could help those symptoms be minimized. Even though a lot of some people may end up in wheelchairs, that's bad news. The good news is 80% of the population of people with MS do not end up in wheelchairs. 80% of the people will live their lives throughout several decades, you know, more or less living normally. They would be bothered on and off depending on what kind of an MS, what type of MS that they do have. But it would come and go. What I mean by type of MS, I should regress there for just a second. They generally type MS into 3 categories. The first one is called benign, the second one is called relapsing remitting, and the third one is called chronic progressive. Now the first one, benign, basically, so what that means is the other 40% of the population with people with MS are people like myself that have relapsing remitting. Basically, that means that we will go through periods of stability, and then all of a sudden, that exacerbation, that acute exacerbation people talk about, we come out of our remission, all of our symptoms come out, whatever those symptoms are for an individual. Okay? Every person with MS has different symptoms. It kind of gets very people get very impatient sometimes with the symptoms because there's no, a neurologist or a person cannot tell a person what their course is going to be like or what kind of symptoms they're going to experience. And we can go back to the good news, bad news thing again, where the bad news is potentially everybody can be affected in a symptom anything that is controlled by your central nervous system, potentially that can affect that part of your body. In other words, your eyes, your speech, your hearing, motor skills, walking, hand coordination, okay? But the good news is not everybody gets all those symptoms. You pick up a reference book on MS and you may see 250 symptoms. Most people don't get them all. For instance, I myself, most of my symptoms are from the waist down. In the earlier stages, I did have some eye problems and things of that nature, but for the most part, my problems are down in my bladder, my bowel area, and my legs. So getting back to the relapsing and remitting, what happens is during remission, okay, there's a period of stability. When a relapse occurs, all of a sudden, all the symptoms become a lot worse. And to try to describe that, I try to give examples in terms of myself. Normally in the morning, if I can stand on my feet, I could probably stand on my feet maybe a half an hour or an hour, something like that, to do things around the house or whatever after a good night's sleep. If I was in an exacerbation, all of a sudden I may be limited to maybe standing time of 5 minutes, 10 minutes. The same thing with the bladder. My bladder normally is controlled by a lot of medication. All of a sudden, if I'm in an acute exacerbation, all of a sudden my bladder medication may not work anymore. And I reach incontinence again. So everything kind of magnifies during an acute exacerbation. And up until, well, just even so, up until today, in the last 25 years, treatment of an acute exacerbation traditionally has been the use of steroids. You know, the prednisone, the solumedrol, the ACTH. Doctors and neurologists will often put patients in the hospital administering steroids to try to lessen the duration and lessen the severity of those symptoms. Sometimes they work, sometimes they don't. Sometimes the patients end up getting side effects that are worse than the benefits that they're deriving from the steroids in the first place. It's a very individual type of thing. So on staff here, you know, you may have patients in the hospital with MS. In all probability, they are receiving some kind of a steroid to treat that acute exacerbation. Other than that, the only other way really to treat it is rest, reduction of stress, you know, just good old plain preventive medicine, but that's no surefire way of making it go away. A lot of times it's just a matter of it has to run its course. How long do acute exacerbations last? Again, it's an individual thing. For one person, it may last 2 weeks. Another person, it may last 2 months. Another person, it may last an entire year. After the acute exacerbation is over, some patients will go back to a stabilized state where maybe they will not sustain any additional damage. Most people will sustain some additional damage. They'll have some residual left over from that exacerbation that had taken place. So, you know, again, it's a very individual thing. Sometimes people get the symptoms that will come out during one exacerbation. They'll go away. The next time the exacerbation occurs, they may get a completely set of different types of symptoms. I personally have had symptoms during exacerbations 10 years ago that if I have an exacerbation now, I mean, I haven't seen those symptoms in the last, you know, 6 years. And that kind of, you know, gets us all very impatient, you know, in terms of, gee, we thought we had this, you know, we thought we understood this and we thought we had everything under control. We thought we understood it, and all of a sudden, you know, we're just blown out of the water. It's like, oh no, now what? You know, what do we expect? And for as long as, even as I've had it, and, you know, 13 years, and you know, I manage it very well. There's still that little bit of fear, you know, an exacerbation does occur. Gee, when am I going to come out of it? How long is it going to take? How am I going to come out of it? And that's where a lot of the programs Ann was talking about earlier, they're very important. What can people with MS do? The best thing to do is, you know, in you and your position, hook them up with somebody else. Listen. You know, the best thing you can do is just listen to somebody. A lot of times, people with MS and you know, when they're going through an exacerbation or whatever, really are afraid. And they really just need a good set of ears to listen to. You know, maybe it sounds like they're whining and complaining, but it's a very, very frightening experience. The peer counseling program that Ann mentioned about, somebody that's in the hospital, just from, I've talked to hundreds and hundreds of people throughout the years, and it seems the best thing is to have somebody else with MS listen to it. Two people talking, they can kind of relate to each other. You know, we could try to understand, somebody without MS could try to understand a symptom somebody with MS has, but somehow it just seems to be better understood by a peer. So hooking them up with a peer counselor, a visitor, encourage them to take part in support groups or whatever afterwards. That's really giving that person some kind of a direction. You know, some place to go, something to do, an ear to listen to, because it can be very frightening. You know, I could tend to go on and on and on, and I don't want to do that because you may have some questions. So why don't I stop here for a minute and ask, just open the floor for anybody that would like to ask me questions. Yes, ma'am.
I'm real curious about this walker you've got here.
Oh, my little my special buggy. I really love this. It's I got this for myself last year. It's which I have a lot of balance problems. I mean, you know, my legs tend to be very weak, and I have a lot of balance problems. I can stand here, but I can't walk without any support at all. When I walk with this, you know, I can walk very easily, and I've got very, very, you know, good support. What's neat about it, it has a set of brakes, okay, that I could put on to hold it still. And then you saw me sitting, so if I'm out, I could shop, I can garden. Even I parked in the wrong place in the hospital, and I really had a long walk to come into the room. So it was like along the way I would sit, you know, I would stop and I would sit and whatever. So this is really a handy little device for people that have MS. It helps people walk better, helps people walk longer, and carries things for me. It's being that it has the braking system, going down any kind of a ramp doesn't get away from me. You know, it's just very easy gripping onto it. It's like a bicycle, you know. So yes, sure. One of the services that the society provides, and it's a very nice service for people who need assistance for to purchase medical equipment such as this, canes, any durable medical equipment, wheelchairs, scooters. The society has a program for their members that they can have up to $500 per year to be used towards medical equipment. Even such things as grab bars, having grab bars installed in showers or in the home, handrails and things like that. Any kind of hard, durable medical equipment that would be needed. So it's $500, which is just super, because a lot of people that, you know, have MS, at some points they have to go on disability, or they have to leave their point of employment or something like that, and they do need some financial assistance. So the chapter is very good. They provide that. Yes?
Can you go from remission to exacerbation? Is it instant? Is it like overnight? Is it over a period of time?
Sometimes it could happen just like that overnight. You can wake up the next morning and...
Ever attributed to anything that they can find? Is it a stressful event, or?
A lot of times it is.
A lot of times it is. Yeah,
in fact, you know, just in September is the first time I had ever seen this in black and white. I've been saying this for years, it's stress, whether it's mental, emotional, or physical, will just yank somebody out and just throw them into an exacerbation. And I saw it in print for the very first time. I've been telling everybody this. Scientific American had a special issue in the magazine in September on autoimmune diseases. And it said in there that for women, and they say women, the 3 things that will cause their condition to chronically worsen are stress, hormones, and infection. Infection will, viruses, colds, fevers, anything like that could throw a person, a lot of times it throws a person into an exacerbation. And what a lot of people don't know is, especially in the hospital here, when they're on steroids, steroids suppress the immunity system. It shuts it down, leaving them open to all kinds of viruses and whatever. And I tell people, don't kiss anybody, don't hug anybody, don't share any cups, wash your hands 1,000 times a day. Because whenever you're on any kind of a steroid, you are really prone to infection, and that could just throw you right back into an exacerbation. So, because I even know myself that when at home, my husband gets a cold, I don't sleep with him, I go in the guest room. My son gets a cold, sorry kid, you have to wait for the kisses, I really watch. And also with the hormones, they discovered that there's a lot going on with the estrogen levels. I talked to a lot of women that find, like, the week before their period, everything just goes haywire. And I've never really talked to anybody yet. I'm still waiting to find somebody. What happens when they go through menopause? I don't know that answer yet.
My mother has had problems because of menopause. She went into menopause early.
Okay.
On top of her MS. And they did have her on estrogen replacement therapy for a while. But she stopped taking it. It's too difficult for her to have the estrogen replacement therapy along with the MS.
Okay.
And she just stopped taking it. That leaves her prone, of course, to osteoporosis and other things.
Okay.
But it's better for her without the estrogen than with it.
Thank you. Thank you. I learned something today. I was so glad because it's a question that comes up. And the same article that I had referred to earlier in Scientific American talked a lot about estrogen. And yes, ma'am.
I have heard that heat and severe cold can also cause exacerbation problems.
Okay, what it will do, it won't cause an exacerbation, but it will cause a bad day. Yeah, and I always make the distinction between a bad day and exacerbation. A bad day could come from, let me explain it this way. It's a temporary worsening of symptoms, okay, that maybe will last a day or two. That could result from heat, and it may not even, somebody can overcome heat. For instance, somebody takes a hot shower, and they come out of the shower, they could collapse. Their legs would get all, buckly and jelly and everything, and they can actually collapse from it. Or a hot summer day in the summertime. I know myself, my walking power is limited to less than a block on a 90-degree day. Or if I'm laying in the sun in the summertime, and this is me, it might be different for the next person, but most people with MS are affected by heat. If I lay in the sun for about 20-25 minutes, I can hardly walk. But if I go in and I take an ice-cold shower, within about 20 minutes, I will rebound, and you would never even know something was the matter with me. So, I did the reverse. But it will temporarily worsen symptoms. So will stress. If it's chronic stress, and we were talking about stress, if it's very chronic stress, yeah, that can throw you into a full-blown exacerbation, which typically is a longer period of time with symptoms that are much worse, okay? A short dose of stress. If I have an argument with my husband, or if my kid just, he's 11, he could set me off, or 10, he could set me off just like that. I'm serious. He can come home from school, and then boom, within 10 or 15 minutes, he'll have me so freaked out. It's like I can't walk for 5 or 10 minutes. It's like I have to just sit down and calm down. And then after I sit down and calm down or whatever, then I can get up and walk again. But it can hit that fast. So it's stress, heat, oh golly, just overdoing it, just pushing too hard. The fatigue. Fatigue is a universal complaint by almost everybody that has MS. In fact, let me talk about this for a second too. I always tell people there's a lot of invisible symptoms with MS. A lot of times we always think of the walking, the legs and the hands or whatever. But the invisible symptoms that you don't see, the blurry vision or the double vision, leaky bladders, fatigue, the tingling sensations, the numbness, the balance problems. There's many, many, many symptoms that people don't see, and they're so important. They are just as disabling to the person that has MS as somebody like myself that, has a walking problem. And it's very important to recognize, very important to talk about. And a lot of them, unfortunately, you can do things with, and a lot of them you just kind of have to learn to live with, unfortunately. You know, like the tingling and the numbing sensation, there's not a whole lot that can be done about that. The blurry vision, optic neuritis, when that occurs, sometimes you can do something with that. Some people say steroids help that, make it go away. Sometimes they say they don't. Sometimes you can get relief, you know, for optic neuritis. You know, I suggested to people the optic neuritis, the inflamed optic nerve can cause really severe pain for people when that happens. And I'll suggest put an ice pack on it. I'm real big with ice packs. You know, it's just, you know, I just forever getting an ice pack. And as my neurologist explained it to me years ago, he said, Debbie, you have to understand what's happening with MS. In your system, that's inflammation. It's inflammation, and you know, you're basically, you know, you're talking about your brain, your spinal cord. And he said if the inflammation was on your arm, you certainly wouldn't put heat on it. You wouldn't want to put something cold on it. So, you know, it was almost the same as true, you know, if you can almost imagine the inflammation inside of you. So I'm a big one for ice packs. You know, and when I'm hot, I get the ice packs and I put them behind my neck. I put them behind my spinal cord. I don't get the optic as much anymore, but in the earlier stages I got optic neuritis a lot and used to have that terrible eye pain. And I used to put an ice pack right on my eye, and it really did relieve the pain. I really did get relief from pain. So ice packs were great. Yes?
How did your body respond to your pregnancy and your childbirth? You did have the MS at that time, didn't you? Did you have any problems with your MS at that time, during your pregnancy or right after? I had heard that right after, usually it can exacerbate. Did that happen in your case?
Yeah, you're right. It can exacerbate. Yeah, in my case, it did. What happened with me, I had a full-blown exacerbation in 1980, and it lasted for 10 months, and then I went into a complete remission. And the only residual that I had left, and at that time, I mean, I was dragging my leg, I was limping, my whole left side of my body was numb and whatever. This went on for 10 months. I went into a remission, and the only thing that was left was a little bit of numbness in my left arm that never went away. And I was in this state for the next 2 years or so, and then I got pregnant. I had the most fabulous pregnancy. There was no problem. There was no problem with delivery. About 3 months afterwards, just the floor fell through, and everything just really went berserk. And then I went into and that gets back into the typing too, when I was explaining about the different types of MS, the benign versus the relapsing remitting versus the chronic progressive. In the beginning, the doctor said, you're benign. Yeah, I was in a remission for a couple years and everything, but then I had the baby. And then after that, it just threw me into, we just couldn't get it to settle down. It took a very, very long time. I've been basically relapsing remitting. But I need to add too, though, I do know people that have had several children that have been fine. I know a couple people, in fact, I know 2 people with MS that have 6 children each. Yeah, I don't know. It's what happens afterwards. I said, you know, when people ask me what should I do, that's a very personal decision. And I say, well, I wouldn't worry so much about the pregnancy. I wouldn't worry so much about the delivery. I would worry about what happens afterwards, because you've got 18 years of everything, and that is what really can kill you. You know, seriously, I think, you know, everybody can relate to that, whether you have MS or not. I mean, you know what kids can do to you, and unless you really have a good support system, look out. Yeah.
Debbie, we're mostly nurses in this room,
Uh-huh.
and we've all taken care of MS patients in acute exacerbation at one time or another.
Uh-huh.
And we all can tell you that that's not the most easiest patient to take care of at points. People are generally depressed, they're sick, they're cranky, they're demanding. What could you tell us that would help us cope with that patient better?
First of all, they're probably really cranky and depressed because they're frightened and they just generally don't feel good. If you don't, anybody knows, if you have a cold or whatever and you don't feel good, yeah, you're going to be real cranky. I always say anything that could make that patient, give them some kind of physical relief. It could be a shower. Amazing, just sometimes as simple as a shower. I talked to a person one time in the hospital. She was in there for about 5 days and hadn't had a shower. And I said, get off the phone right now and go get a shower and take a cold one. And so, you know, anything that could be done to make that person get up, talk, to listen to the person, offer, you know, say, would you like for me to try to find somebody with MS to talk to you? If they're really depressed, which is very common. Depression is another thing, the symptom too here, if I could just talk about that for a second. A lot of times depression will just happen because a person doesn't feel good, and you know, a lot of people automatically assume it's because of the illness. But in addition to that, depression can also be a direct symptom of the disease, which a lot of people don't realize. The disease could affect that part of the brain that can cause depression. And that's important because I try to tell people that a lot of people are ashamed to think that they're depressed or they don't want to do anything about it. And I know a lot of people that have needed to go and get on antidepressants. So if you would recognize a case, and if you think, you know, if that person is just not shaken out of things, maybe talk to the neurologist and suggest maybe having a psychiatrist come in and maybe trying an antidepressant, and you know, because that could make all the difference in the world too. I know I've talked to people as the Prozac, the happy pill, but there are a lot of MS people right now. I keep seeing you nodding. I know you're a person with MS, right? I know. No, that's okay. That's great, because I know when you keep nodding, then that means, well, I guess I'm saying the right thing.
Unfortunately, you're hitting it on and right on the head.
Good. Okay. Okay. It's a Prozac. I know a lot of people that are on Prozac, and you don't have to be on a heavy-duty antidepressant, but you know, a lot of times, you know, that's a very serious symptom, but it's one that can be managed. You know, there's a treatment for it. And that's the thing, you know, to make the person feel better. A lot of times just talking about why is that person so miserable. You know, when I was in the hospital, I went in with a very acute exacerbation about 7 years ago. And one of my problems then was my bladder. And I just was so miserable because by the time I had gone into the hospital, my bladder was not working at all. I was wetting the bed every night. I didn't know what to do about it, and I was working full time, so I was wearing Depends. And when I had gotten into the hospital, I was just, not only did I didn't feel good, it's just I was cranky, but I got sick and tired of just waiting in bed. So finally, you know, I asked, I said, gee, is there a urologist on staff around here or something? And amazingly, nobody said anything to me. I had to say it, and all of a sudden the urologist came in. It was like the beginning of my happy days, because then we worked at it from there, and then now I haven't wet the bed in years, you know. I mean, that's one of those areas. Here we go back to good news, bad news. 80% of the people with MS will develop some kind of bladder problems. The good news, that's the bad news. The good news is most of the time it can be medically treated, and people can live normal lives so that they don't feel like their bathroom problems are controlling them. Okay, so that is a good thing to know. Get them to get a urologist in. But anything to make that person physically feel better. Get them up, get them talking, get them in a shower, get them. A lot of times, if the room is too hot, you know, a lot of times if the person is over medicated, that's another problem that's occurred. And a lot of times, you know, just be aware of the different kinds of medications. A lot of times, side effects from medications, especially, and I should mention this too. I'll get your question in a second. The steroids can have just such terrible side effects, and people need to be made aware of them. You know, I get sometimes, this is a personal thing with me. I wish that everybody that was admitted into the hospital could be given a whole big instruction. I would love to talk to everybody about steroids, just to warn them, because they do cause mood swings. They do cause insomnia. They do cause crankiness. They cause all kinds of things. So a lot of what they're experiencing, and I say it's okay to say, do you want a sleeping pill or do you want an anxiety pill? I'll talk to your doctor about it. Does this all help?
Yes, it sure does. I think it's helped everybody in the room. We have time for one more question.
Okay.
I was just curious, the girl in the film, she lost her vision.
Okay.
If you go into remission, can your vision return?
Yes.
Okay, so you can go
Yeah.
completely blind and then get your
Yes.
vision back.
And that's another good news, bad news thing. You know, a lot of people do have vision problems, especially in the beginning. And that's what leads a lot of people to get diagnosed in the first place, the optic neuritis. Most of the time, the vision problems go away. They don't last. I myself went like mostly blind in my left eye, and it all came back, and actually my vision today is better than it was back in the very beginning. So it's...
Well, I don't know about everybody else, but this has been very enlightening.
Great.
Thank you.